Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health, like my guest, Meena Sandhu from Careteam. Meena, thanks for joining me today.
Thanks for having me.
So, I have loved learning about Careteam over the years and learning about your unique take on patient engagement. So, break it down for me. What is Careteam?
Yeah, so Careteam is in that care coordination and patient engagement space. And we hear that a lot.
Yeah.
So what Careteam does is we really connect the entire ecosystem around the patient. So there are a lot of technologies out there, a lot of platforms where there's texting enabled, they say that there's a connection, there's access to information, but is that information meaningful? Is that information surfaced when it needs to be surfaced? The right amount of information at the right time so that patients can really act on the information that's necessary.
Okay.
And how do we actually connect the patient back to their community, back to their physicians?
Okay, so how does Careteam do it?
Yeah, so we connect, say, you have a specialty care physician and they will connect to the patient. The patient on their own can invite their personal care team, a son, a daughter, a family member, another friend. They can share their care plan with a community group that's supporting them, with their primary care physician. Any individual or organization that touches the patient journey can be involved and engaged in that patient's care plan, knowing exactly what has happened, what's going to happen. They don't have to go through that same repetition that we've all been through. You see one healthcare professional, you go see the next, and you're repeating your same story
always.
over
Always.
and over and over again. Yeah.
So let's just take a really concrete example. Let's
Yeah.
say that I'm a patient who's just been given a cancer diagnosis, and they have Careteam, and so I'm now on an app. Is it an app?
Yeah, it's a cloud-based platform.
Okay.
So your oncologist would set you up into the platform. They would have a care plan set up for you already. You'd be invited in. It's a single click. We're fewer clicks. We want it to be easy.
Okay. So then I'm on the platform, and then what you said was I'm able to invite non-traditional members,
That's right.
let's say my friends and family, into my care team.
Yeah.
How does that work?
Yeah, and then you can assign roles to them. You say,
Okay.
okay, maybe you have a spouse that's going to be the most actively involved. You might have a child who's out of healthcare, and they're going to be doing the tasks that are more oriented with making sure that you're staying on top of your medications.
Okay.
And you might have somebody else local that helps you with transportation to and from hospital or doctor visits. You can really get a team around you because it does take a team.
This is maybe a bad metaphor, but I almost think about like roles. I'm used to using Google Docs, and one person is the editor, and one's a commenter, and one's a viewer.
That's right.
Different roles that people understand in a collaborative team.
Exactly. We say you can connect, you can coordinate, and you can collaborate with Careteam.
And some people might just be viewing what's going on, right? To be aware.
Whatever makes sense in terms of how you need to build out your personal team.
I remember talking to Alexandra, one of the co-founders, about even the idea that in order to get to care, you might need someone to watch your dog.
Absolutely.
Yeah, there's these things about your care
There's so
journey.
much that needs to happen. Perhaps you need to take care of your health. You have young children at home. Who's going to be watching the kids? Who's going to be picking them up to and from school when you're at a doctor's appointment?
How is something like that integrated into the platform? I'm curious.
So it's in a couple of different ways. One is just simply assigning duties to the different people that are contributing to your care.
Okay.
And another way is, you can actually schedule an Uber ride to pick you up or drop you off from your appointment. And we've integrated that all into the platform.
It's integrated in?
Yeah.
Really? Okay,
Yeah.
From the platform, someone you've assigned to be a helper could call you transportation.
That's right.
Okay.
That's right.
And then
we want to make that experience as seamless as possible and avoid the patient having to go into multiple different tools and technologies and platforms. Just keep everything contained into their care plan.
Very interesting. And I know a big piece of this is that it then flows back to the doctor.
That's
so
right.
How does that work? How are they handling all of that information?
Yeah. So they've set up the initial workflows and the care plans, and what they're seeing are the tasks being completed.
Oh, interesting.
It's it's almost like you'd have in the business world. You have your project management tasks, and this team member's done this and this team member's done that, and you can see how the care is moving, how it's progressing. You get a sense of sentiment. You know, we also check in on our patients through the platform.
Okay.
How are you feeling this week? Was it a good week? Was it a positive week?
Okay.
Need some extra support? You
So
can see, someone's kind of fallen off their regular daily habits. It'd be great to get them engaged, and their physician can jump in and say, you know what, it's time to do a check-in with you.
So instead of this black box
Yes.
between appointments,
Yeah.
they're actually watching this
Yeah.
journey go along.
That's right. Yeah.
They've got someone watching their kids while they come to the appointment.
Exactly.
They've got a ride to the appointment,
Yeah.
and it's all visualized.
Yeah. We're
Very
that place between hospital and home.
interesting. How do you go about, and I'm sure you're in this process, how do you go about validating that giving somebody that Uber, watching their kids while they're getting to their appointment, has tangible positive effects on their health and the cost of care?
I think it's an overall patient engagement level, so we can see that the more personal care team members somebody's invited, the more likely they are to stay on track.
Okay.
The more likely they are to attend all of their appointments, to stay compliant, to stay adherent. So we know through the app, those that have no personal care members versus those that do have a personal care team built around them are more likely to progress in a positive direction in their health.
Interesting. Where does the company stand today in terms of your rollout, who you're working with, and where would you like to go this year?
So we are making a big effort. We're a Canadian company, and we're making a big effort to really gain traction in the U.S.
Okay.
And honestly, being a part of Startup Health and coming to ViVE, coming to Health, this makes a big difference for us to get face-to-face and build those connections, those relationships, so we can really start entering the U.S. market actively. So that's our focus this year. Yeah.
Who's an ideal partner for you?
So an ideal partner, ideal customer are providers, health systems. That's where we really need to start, and where we have the ability to start with a small implementation and scale broadly across an organization. And we've had the chance to meet with several great providers and health systems while
So
here.
do you work with individual hospitals and clinics, or do you need to, because of the longitudinal nature of the platform, do you need to work with larger health systems?
We can work with individual clinics, individual department heads. Oftentimes, it's that health innovator, clinical champion that really gets us in the door. Those passionate physicians that want to change the way care delivery is done for their patients.
I love it, Meena. I love what you're building. Appreciate you taking the time with me today,
Thank you.
and we'll be watching you in 2023.
Thank you.
All
Look
right,
forward
thanks.
to it.